points this morning. For those people presenting reports, I can just ask colleagues to draw any particular changes in the report, because bear in mind colleagues will have read the reports already. So if we can keep the presentations as brief as possible. We are going to look to take a short break at around 11:30 this morning. So I'm conscious we've got a lot on the agenda this morning, so we will take a short break at around that point. Can I welcome to the meeting Becky Gammon, our interim Deputy Director of Nursing, who is deputising for Richard Hughes. Just to mention to board, Ben Screen, who is the Welsh language lead, is joining later in the agenda to present the Welsh Language Standards Annual Performance Report at 6.5. And Rosie Cavill, our LHP Infrastructure Programme Director, is joining the board later to take part in the presentation of agenda item 7.2. As you can see, three of our colleagues are joining us online this morning: Rachel Rowlands, Patsy Roseblake, and Hayley Proctor. Good morning, you three. Good to see you this morning. We've had some apologies under item 1.2. Richard Hughes, our interim exec director of nursing, Alex Brown, associate board member, alongside our other two associate board members, Lisa Curtis-Jones and Paul Deanick. So sadly, they're not able to be with us this morning. Item 1.3, declarations of interest. I've not been notified of any, but is there anything anybody needs to raise now, bearing in mind the agenda? No, all fine, great. Under item 2, just to say, as usual, there are a list of matters contained within the consent agenda towards the back of today's board meeting. Having had the chance to look at those matters, are there any that you would like to have brought forward earlier into the main meeting? No, and you're happy that we'll deal with those towards the end. Okay, thank you very much indeed. Moving on to item 3 and item 3.1, which is our shared listening and learning story. And following a discussion in previous board meeting, we did decide that we would review the stories that the board has received over the past 12 to 18 months. And really pleased that Becky is able to lead this item this morning and to present the report, which sets out the learning, I suppose, that's been achieved following the stories that we've considered at board. And as part of that conversation, as we do for all shared listening and learning stories, it is about that so what question. We've heard people's experiences, either good or bad, whether they be members of staff or patients and their families, and then how do we ensure that we are learning as an organisation. So really grateful for the way in which this has been pulled together in the format you've done. So Becky, thanks. I'll hand over to you. Thank you.
Thank you. So I would just like to say thank you as well for every person who shared their story with us, and the impact this has had on us as you know, working for the NHS, to allow us to reflect on our services, and also how patients, relatives, service users have helped us improve our services. So thank you for that. So I'm just going to briefly take you through some of the stories that we've heard over the last year. So Kira's story was shared with us in January. And Kira was 15 years old when she came into our services using the CAM services, following a particularly difficult time where she was suffering from anxiety. And Kira felt that as an adolescent, moving into an 18-year-old as well, moving into mental health, her voice wasn't heard. She felt there was some lack of compassion, there was lack of consistency with clinicians. When she was going to clinic, she had a number of different therapists, and actually that was never told to her before she got to those appointments. Some areas that mental health did look at was setting up an advisory board where young people came to and their voice was heard, and they were able to use that space to direct some of the services that mental health were delivering. They also set up a single point of access. They reviewed their letters, so their letters are much clearer, where there was signposting as well for individuals that were using that service. And as of October, they've increased their assessment of 28 days. And they've also increased their single point of access to 94%, in that primary care are now getting a letter back to individuals within 28 days. So the next slide, thank you. So this is a sad story that was shared by Darren, who sadly passed away now. Darren and Phyllis shared their story where Darren was diagnosed with cancer back in March 25. Part of his diagnosis needed him to come back and forth to our services to allow drainage of our ascites, which is fluid that builds up. However, initially when Darren came back, he had to come via A&E. It was a long process. He would sit in A&E, he would be referred to our surgical colleagues, then we would wait further for the treatment. PCH in Ward 6 set up a trial of a hot clinic, which allowed Darren and patients that required intervention to come back and forth for set clinic time, to be seen by the specialist doctors at that time, to avoid completely A&E. That has now been successfully rolled out across PCH, RGH, and it's now being looked at how we can roll that into POW. And that's absolutely kept the time of patients going to A&E. But for Darren and his family, allowing him time to be at home, that's such an important time, and not spending time waiting in our services and our A&E department. Thanks, Emma. So the maternity and WAS shared their story back in February 25, following the story of Catherine, who had twins, Karen and Naira. Catherine went into labour at 29 plus weeks, and following the birth of her twins at home, she also had a postpartum hemorrhage. WAS were able to respond to these deliveries. One was breech, so their story is around everything that could go wrong went wrong. She was breech, she was premature delivery, they were twins, and following the work that the maternity service had done with WAST and the extra equipment that had been put on the vehicles for WAST, they were able to keep these babies in a normal temperature till we got them to hospital. And there's pictures on the website of these beautiful twins now 6 months on. So it was a really good, positive story. And what came through this story was the collaboration and partnership of secondary care WAST and the services that were working together. So it was a really lovely story. The story for the transition from paediatrics to adult services, this was relating to Gary, who was the dad of a young lady who had spent a lot of time in our children's services with complex needs through the learning disability services there. They were extremely worried when their daughter changed to move into adult services and the transition, because her paediatric services was so well known to her, and the clinicians that we worked with her knew her really, really well. And they were really concerned when she was going to move into adult services, whether she'd been seen in that individual holistic space. However, when the team knew that their daughter was coming across into adult services, they spent a lot of time with Gary and his wife and allowed them to visit their daughter to understand her needs. It also came through as part of the family planning. They had a care plan together, and they were able to have the building partnership, hearing from the family what they wanted. And during the transition, when their daughter became very unwell, Mum and Dad felt confident and trusting to leave their daughter in ITU, which they'd never ever done before. So it was a really positive story around the transitioning again, that adult to paediatric, to adult services. But what we've also done, and I tried to capture there, is where we've also looked at wider transition services as well. And some of that transition is around our looked after children, the work we're doing with our looked after children that are transitioning. The work with CAMs that are transitioning, which I mentioned earlier. So there's a lot of work going on in the space of transitioning from paediatric to adult services. And then finally, we were shared the story of Alan's experience from Rian, his daughter. And again, sadly, Alan has passed away. And Rian's story allowed us all to reflect on the need for kindness and compassion. Alan was in hospital for some time, and there was a number of areas where lack of compassion and kindness caused anxiety to Alan and his family. There was also a lack of communication on times, and just the compassion needed when somebody was in hospital at such a difficult time for their family as well as those individuals. And some of the areas that we've looked at to support, we've rolled out those professional standards reflecting conversations across all our staff groups. We've also devised a patient information leaflet, which again signposts and supports relatives and patients where they can get help when they're patients within our services. We're also going to be rolling out John's campaign, and part of that will be a carer's passport. So that will need our clinicians to sit with our carers and our patients and devise a care plan jointly of what they need to support them when they come into hospital. And we've also set up our workshops for the primary care bereavement services and framework, and we're filtering that through into the wider work of bereavement that we're doing there. So that was just a quick recap on the stories and the work that we've been doing so far over the last year with the cases that have been raised and the stories shared.
Thank you, Becky. That's really, really appreciated. And yeah, to see the list of the things that we did as an organisation, I think just again, captures the importance of ensuring there's a response when people are raising particular challenges and bringing their experiences to us as a board for us to reflect on. Any questions or comments? Dom?
Just a quick comment on there. So, huge amount of work by so many different teams in this. The one area that particularly, because it comes under me, is the transition care from teens to adults. Actually, there's been a fair bit of progress even from then. We've got a task and finish group who are really going at it. We are Cardiff are a little bit ahead because they've got the lead sitting in their organisation, but we are very much ahead of the curve everywhere else. We're about to adopt the Ready Steady Go approach, which is England's approach. We're going to roll out across Wales, but we're going to go to starting that already. We're going to start as paper ball just to get it going, and then the plan centre go that digitally. So we are on track to start rolling that out properly within the new year. So it's really good progress, and that's because of things like this, it's been highlighted. We picked it up and can say the board have put their support behind this. We're going with it. So thank you for your support now.
Thanks, Dom. Lauren.
And I think there's something we can do here in terms of monitoring the effectiveness by looking at our PALS feedback, and we can identify whether there's any of these themes coming through.
Yeah.
And then that allows us to check the effectiveness of these changes.
Kevin?
Yeah, no, it really helpful, Becky, and thank you. And I guess it builds on. So we discussed Alan's story yesterday at Operational Management Board, and we played Rian sharing his story that we heard at board, and understandably had a huge impact on our operational leaders as well. I guess it's brilliant that we've been able to identify a number of these actions and how we've embedded them for these individual positions. I guess there's something that we need to consider about that thematic piece and how, as Dom's just described, the work we're doing around transition, because of course, we talked about it specifically in the case of transition from LD services. We know we have transitions to challenge across all of our services, and so how do we take that learning and embed it everywhere? And I guess there's one of the conversations that we got into on the back of Alan's story was one about culture, and so there's practical things we can do in response, but there is also something that's about a broader piece around culture, how we behave, how we